How I ended up at Health and Hope about almost 5 years ago now. They had come looking for volunteers to the naval base. I was a hospital corpsman stationed there at the time. We got a mass email saying looking for volunteers, and I'm bored when I go home at night, so why not? I have a couple nights a week that I could go to help out somewhere. I applied, and less than 24 hours later, I was onboarded, and I've been a medical assistant here ever since. My main priority is community outreach. I go out into the community and serve our underserved populations.
So you go into their homes?
Not into their homes. We do a lot of community events.
Okay.
We host a lot, and we attend a lot of other outreach events that nonprofits put on.
Give me in a layman's term what it is you really do. You corral folks, or you just interact with the community to let them know you're here, or what?
Both. We give information about the clinic because we are a free faith-based clinic, and we want people to know about it. It's alarming how many people we encounter in the community that don't know that we exist. But we go out there and we provide them the things that they can't get normally. So point of care cholesterol tests with finger sticks, glucose monitoring, blood pressure tests, the things people don't want to talk about, we're out there talking about and helping them get the resources that they need.
Is there one particular story, or one case event that's happened that stuck with you and reassured you that I made the right choice in doing this?
Honestly, every day I come here is that for me. I interact with patients on the daily that are so incredibly grateful that we are here, that, you know, I know that this mission that I'm on is the right mission, and God has put me on this path for a reason. And every day I'm here, whether I'm out in the community or here in the clinic, I touch a patient, they touch me, and we're, you know, interacting together with God. And it's incredible.
There's got to be one more.
One.
Or at least one more.
One specific story. We do have a patient who has really been struggling to get here, just to the clinic, to get care for himself. And, you know, we've worked really hard with getting him on our food as medicine program to try to help alleviate some of the life stressors that he is experiencing. But his whole story about how, you know, he can't make it here, he has no gas money to get here, he has no food, really solidified in me this program that I'm working for and the reason that we're doing it. Absolutely.
How have you helped him being able to? So what happened?
Well, so his health has definitely improved. He's not been in the ER as frequently. His weight is coming down. His blood sugar levels are evening out. And that's the goal of the program that we're running, is to help these people kind of get to a lower base level where they're feeling more comfortable.
So how were you, though, able to help him in terms of getting here, gas money, that kind of thing?
So we can't help with the gas money part of it, but we do have a ton of resources. The 211 guide we give to every patient that is seeking any kind of resource. And the 211 guide has so much for people. I'm not sure how they've been able to get here, but they have been able to come and pick up their fruit and vegetable boxes. They have been able to come and get their labs done. And that's the critical piece of it, is that if we don't have those numbers from their labs, we don't know how we're affecting their lives. And just having that qualitative data and quantitative data is essential to what we do here.
Perfect. See, that was Sam. So what's that story you can share with me?
So a few weeks ago, I was acting nurse. I'm not an RN here at Health and Hope Clinic. My actual title is Assistant Program Director of Minority Medicine and Community Outreach. So I work under Carla Davis. But that day I was acting RN. And I got a call from the company that we outsource our pathology to. And they said, one of your patients has cancer. And I said, okay, what steps do we need to take now? How do we move forward? I said, you need to get the patient in for a reevaluation, further evaluation, and to get treatment. And so working with our clinical director, Bonnie, she gave me a lot of trust in talking to this patient and getting the patient in. And last night, we saw that patient and did, a cervical biopsy. But the gratefulness on her face that we caught this cancer and that it's not costing her a dime changed the way that I see what I do here. My presence in that room, she told me afterward, changed how she feels coming into this clinic. And that made me feel like my mission was right where, it's right where I'm supposed to be. And so I really wanted to share that story with you guys. And
Sam, was this last night?
This was last night.
Oh, wow.
Yeah, it's very fresh. That patient is very afraid, and I understand. We're going into holiday season, and we just want to spend time with your family, and I can understand the fear that such a diagnosis comes with. But the importance of this clinic is that we're faith-based, and God has us, and that's what we have to focus on when we get the bad news, because that's what's going to pull us through.
Sam, a little bit of background on her. What was her particular? Is she alone? Is she has nowhere to go? What was?
She was here alone. Her sister brought her. She didn't want to tell anybody yet that she didn't get a cancer diagnosis. And so we did the procedure we needed to do to move her forward in care with specialists. And she was very grateful, and she doesn't want to tell anybody quite yet. She wants to enjoy her holidays and let her family enjoy her holidays, so I do not fault her for that. But us being here could potentially have just saved her life. And I hope it does. We don't know what the outcome is going to be, but the fact that we were here made all the difference in this woman's life. And that's how our patients make the difference in our lives. So just wanted to share that. Thank you.